Good evening and welcome to COVID and the Classroom, a special programme where we hear from young people about the impact the pandemic is having on their education and their well-being. Well, on Monday, the Prime Minister will set out his roadmap for lifting coronavirus restrictions in England and has previously said that reopening schools was a national priority. Well, the extent of the problem is clear. There are around 8.9 million school children in England. Of those, the latest figures show that 894,000 children are of critical workers and are attending school. An average child's already missed 114 days of school. That's half an academic year. And by the end of the pandemic, a young person could have seen 5% of their academic career affected, and this will have an impact on their prospects and their well-being. The Institute for Fiscal Studies calculates that the average young person could see a loss of £40,000 in income over their lifetime. And without government intervention, that could add up to a total of £350 billion in lost lifetime earnings. And on the issue of mental health, the Children's Commissioner for England has reported that 1 in 6 children aged between 5 and 19 has a mental health disorder last year. That's up from 1 in 8 3 years earlier. Well, in the face of these problems, the government are pumping in money to support children and young people with £1 billion to fund a catch-up premium and a national tutoring programme. But some believe this is inadequate. Well, over the past few weeks, we've been hearing from young people and their parents about their experiences of education during lockdown. And on the eve of the Prime Minister's announcement, we've revisited some of them to find out what they want Boris Johnson to address. And then we'll be getting the view from our expert panel. Tonight, David Laws, who's chairman of the Education Policy Institute and former schools minister, will be joining us, as well as Rachel Warwick, a former president of the Association for School and College Leaders and the executive head teacher at Ridgeway Education Trust. And to get the clinical perspective, we'll also be joined by the GP, Dr. Ellie Cannon. A very warm welcome to all of you. But first, let's start the programme with our first question from 13-year-old Brooke Norbury.
Should pupils get weekly tests for coronavirus?
OK, short and sweet question there. To you, first of all, Rachel Warwick, because this has been the subject of the day between the unions and the Department of Education, whether it should be done by teachers or whether it should be done by parents. What's your view?
I think we need to follow the science, and that's something we've been saying at Association for School and College Leaders all the way through this crisis, and we'd like to hear more from the scientists. First of all, about the efficacy of lateral flow tests, which is contested, and actually some understanding about the logistics which are required to test children in school. For example, one of the secondary schools in our trust has 1,600 children. It would take us 2 weeks to test all of them twice with 3-day intervals, as has to happen for LFD testing. And we're happy to do that as long as we know it's really going to make a difference, it's going to be accurate enough to make all of the young people and staff in the school feel reassured about coming back into schools very soon.
And Dr. Ellie Cannon, do you think this is going to be a useful tool? And just on a practical level, how easy is it going to be, certainly for little ones, to have weekly tests?
Well, certainly lateral flow tests are pretty straightforward, but Rachel's absolutely right. In very large schools, how is that actually going to be feasible? And with any intervention in terms of health and lateral flow testing, we would regard as a non-pharmaceutical intervention. We always talk about the benefits versus the risks. So it sounds like a good idea to be testing kids every week, every other week, to look for cases. But actually, is it a good idea? Is the efficacy there? Is it proven that actually then quarantining those children is going to be of benefit, both to the child and also to the community transmission? And are the tests good enough for that purpose? And this really needs to be clarified by the government and by the scientific advisors.
OK, and let's bring in David Laws on this point. There's a lot of pressure on the government to get this right. Schools need to stay open now, don't they? Could this be a useful tool in making that work?
It could certainly be a useful tool, but I agree very much with the two other guests that we need to think through the practicalities of this. And it's surprising to me that just 3 or 4 days before the government plans to announce what its strategy is for reopening schools on the 8th of March, there still seem to be quite detailed discussions and controversies about this. It's going to be an enormous challenge for schools or for parents if this is going to go ahead. And really, there needs to be more notice in this area and in other areas so that schools have a proper chance to plan.
OK, not to say it can't happen. Of course, we've seen, haven't we, the huge success of the vaccine rollouts. Well, let's move on now to our next question. And this is about the crucial issue of the future of exams. We've had a few on this. Let's take a listen.
Do you believe it will be fair to make the 2022 exam cohort sit a full examination series next year, given the impacts on their education since March of 2020? And if so, how would you justify that with the discrepancies in remote education due to digital poverty?
What is being done to help the Year 11s and Year 12s who have heightened anxiety sitting exams due to the fact that they weren't able to sit their GCSEs?
OK, let's bring David in on this first of all. Are we going to see real differences, do you think, in exam results as a result of those disparities in remote learning?
Yes, we're certainly going to see a very big difference in the amount of learning that young people have. And that's one of the reasons why the government eventually decided to scrap formal exams this year and to rely upon teacher grading so that they could take into account to some extent the lost learning over the last year or so and not actually penalise students who have lost a lot of learning time for the way in which they may have suffered. Now, there's a key question, as your first questioner put to us, about whether or not exams on a full curriculum will be able to go ahead in 2022. And I think that depends crucially on whether or not we manage to get all students back on the 8th of March and whether pupils stay back in school now on a permanent basis. If they do, it's possible that we would be able to catch up some of the learning for those who will take their exams in 2022, and we might be back to a normal examination series covering most of the curriculum. But if students lose a lot more time over the months ahead and are going back and forth in and out of school for the rest of this year, then we might need other contingency plans for 2022. And we ought to have those well worked out again in advance so that teachers and school children are not suddenly landed with big changes where they don't actually know what the plans are for a few weeks or a few months ahead. And on the second question about getting students used to exams who've missed their GCSEs and who've had a very different learning experience this year. I mean, I think if exams are going to go ahead in 2022, the normal GCSEs and A-levels, then it's a good challenge to schools that they will need to get their pupils used to taking those exams. Obviously, schools are very good at that. They're very used to having mock and other examinations, and that will be a way of allowing students who have missed GCSEs to prepare properly for their A-levels.
OK, so a lot of it will depend on how quickly we can get students back into the classroom. I want to bring in Rachel, and I want to talk about the A word, not in terms of grades, but of course, algorithms. No one wants to see the return of those, do they?
No, what we don't want to see is a repeat of what happened last summer, most of all for the young people who are waiting for, who are due to take some form of assessment for their GCSEs, A-level or vocational qualifications this summer. I think I just go back to David's point about timeliness. We haven't had a lot of forward notice from government about the changes we've been asked to manage in schools and colleges. Despite that, I think we've done a good job in terms of being responsive and agile. But with reference to your first question, I would say that we do need some mitigation for the 2022 exams because of the differential learning loss, which the current Year 10 and Year 12 have already suffered. And we really do need to know what that would look like if we're going to have some curtailed content for exams, for example, before the summer holidays, so that teachers have time to plan the curriculum appropriately for when students come back in September. So their experience is measured and they feel reassured that teachers, always acting in their best interests, have the time to prepare and to make sure that the work that they're doing is really going to pay off for them when it comes to those exams in 2022.
And of course, Dr. Ellie, I know you'll have picked up on the word anxiety being used in that second question there. I know it's an issue as a GP that you're seeing with youngsters. Let's just, before I get some response from you on that, hear from 16-year-old Emily Harris. She's got a point to make about youth services and is really worried about it.
I think it's really important that we don't underestimate the impact that youth services are and will be having on young people in lockdown and post-lockdown. And one of the things that's kind of causing a lot of anxiety in myself, at least, and probably a lot of other young people, is the possibility of change when lockdown ends. So I think one of the things that's making me most anxious is the idea that now that I've become accustomed to this kind of support from youth services, when we come back to school, that kind of support will evaporate and the change I don't know how well I will be able to adapt to the change, or how well a lot of other young people will be adapting to the change. And that's quite a scary prospect.
You can really hear the worry in her voice there, Ellie. And look, whether it's about lockdown ending and the change that's coming, or whether it's in having to face exams, not feeling like they're ready for it, how worried are this generation of kids are you finding?
Oh, they're incredibly worried, and anxiety is just one of the many mental health problems that you alluded to in your introduction. 20% of children are now suffering with a mental health problem, and they are just the ones who have actually reported it and been counted. I'm sure that actually there are many, many more who go under the radar, and that's very worrying. Young people have had their lives turned absolutely upside down, and they have not been prioritised in the last year. Obviously, we're talking about schools now, but their whole lives have been turned upside down. Their relationship with their peers, their ability to do physical exercise, their ability to go on and achieve the milestones they want to, whether that is taking on an apprenticeship or leaving school or whatever it is. And we have to be incredibly mindful of that going forward. There are too many adults and too many people who are experts who talk about children and young people being resilient and bouncing back. And I think the teenager who just asked the question perfectly illustrates that actually many young people are not resilient, and we can't just expect them to bounce back, just like we wouldn't expect an adult to bounce back.
It's been one of the big paradoxes of the whole pandemic, hasn't it, that the children who are actually least affected by this virus have actually had to pay one of the biggest prices. Let's move into our next question now. This is from 13-year-old Hina Goto.
All my cousins living in Japan haven't missed a day of school. Japanese schools have remained open throughout the pandemic. Teachers and students there wear face masks all day long, including during lessons, and lunch is taken in classrooms so that kids don't face one another while eating. Here in the UK, I'm wondering why we're only required to wear face masks in the hallways and not inside the classrooms too.
OK, well, let's ask David Laws his views on this. I mean, it's quite extraordinary to think that their schools have stayed open throughout all of this in Japan. Certainly for the kids here in the UK, totally different experience. Could we have done things differently? Are there lessons to be learned from our international neighbours?
I think there are certainly a lot of lessons for us to learn as a country, not just about how we've managed this in the education system, but across the whole of society. And we looked pretty slow moving as a country early on in the pandemic to take some of the actions that we needed to take. It was also controversial, obviously, how we should deal with some of the protective elements around this. And as you know, not just in schools, but outside schools, the advice on whether people should wear face masks at all changed hugely in the first 6 months of the pandemic. So I think that this is a perfectly sensible question to ask. Should we be following other countries in using face masks more in school? We know that policy has evolved in this area, but that really has got to be one for the medical experts who advise the government on these matters. And it's important as far as possible that we follow their advice and look at the latest evidence that we've got about, for example, the way the virus transmits between young people and the way that the virus translates outside school between young people and older people. So we need to follow the medical advice on this.
OK, it's going to be a work in progress as well, isn't it? OK, David, thanks for that. Let's move on to our next questions. We've got so many. I want to make sure we get through as many as we can. This is from 13-year-old India Sethi.
Given the fact we may be going back to school in 3 weeks' time, when should our wonderful teachers get vaccinated?
Oh, long may that enthusiasm for teachers continue, hey, Rachel. Do you think that teachers should be bumped up the priority list?
I think it was entirely appropriate that the vulnerable, the elderly and NHS frontline workers were prioritised in the first instance for vaccination. And I know many of my colleagues do in teaching as well. But we do feel now in the second phase that vaccination should be prioritised by occupation. There are just under 1 million teaching and support staff in schools in England. And I think the risk of those people working in crowded schools where there's very little social distancing possible, and in primary schools where there is no social distancing between students and staff, is very different to someone perhaps in their 50s who's working from home and is not going to expose themselves to a similar type of risk. So for me, to give reassurance to staff in our schools for who I feel responsible and there's a duty of care, I really do think that there should be some urgent thought given to prioritising teachers and educational support staff in this country for vaccination now, as soon as possible, yes.
I mean, it's a phrase that's used a lot. We talked about it earlier, about following the science. Certainly, Dr. Ellie Cannon, the government say that the JCVI believe that not profession but age should be the most important factor when deciding who gets the vaccine, and not just age but also clinical condition.
Yes, and that's absolutely right. But at a time when, first of all, we are doing incredibly well in terms of the vaccination programme, and many people now are being offered the vaccination around the age of 50. So we are actually moving down the groups quite fast in some parts of the country. And also bearing in mind what we've already talked about, which is children have given up a huge amount in the last year. And have been put at risk. They've not been put at risk from COVID, thankfully, but they've been put at risk from loss of physical development, from effects to their mental health, children who are vulnerable in terms of the support they get from school that's not been there. So we need to look at ways to mitigate that risk. Now, it might be that vaccinating teachers, if you simply weighed it up against the other JCVI groups, cannot be justified. But we have to look at vaccinating teachers holistically in terms of the fact that getting children back to school now is a priority. And therefore, if there is groundswell from teachers to feel more comfortable by being vaccinated, it's certainly a safe measure, then we should be considering prioritising them in order to then prioritise schools reopening.
OK, interesting point. Thank you very much. It is important to stress, I should say, that Boris Johnson will only be setting out a plan for schools in England when he speaks next week. There are, of course, different timetables for the different nations of the UK. So as India was saying in her question, in England, as it stands, all schools will continue with remote learning until March the 8th at the earliest, although Boris Johnson may have more details next week. In Scotland, the government's announced a phased return to school from the 22nd of February, so that's this coming Monday. And similarly, in Wales, schools will begin a phased return for foundation phase learners, that's 3 to 7-year-olds, from the same date. Whilst in Northern Ireland today, it was announced that some primary school pupils will return on March the 8th and exam pupils will go back on March the 22nd. Now, our next question is from 14-year-old Trey Corliss.
If the plan to open schools by the 8th of March goes ahead, will the government be taking a risk if people haven't received their second dose of the vaccine?
Now, I want to put this question to Ellie because I know that you've personally actually been involved in one of the vaccine trials. What's your view on the interdose interval? Is it a bit of a risk?
No, it's not a bit of a risk in terms of the public health emergency that we are in. And the first dose, both of Pfizer and of AstraZeneca, gives a very good level of immunity. And in order to get that population immunity up, actually it's better to get a large number of people given their first dose than it is a smaller number of people both doses. And of course, people are going to get their second dose. It's just going to be around the 12-week mark. Transmission is probably going to happen in schools. There are almost 10 million children at school. So, of course, once we send children back to school, there is going to be some level of transmission. And that's why we have to take this slowly, keep everything else closed so we can open schools and so we can actually see how it goes. That doesn't mean that transmission is particularly high in schools. It's just a reflection of what else is going on. So if schools are open and nothing else is open, of course you're going to see transmission in schools. Vaccination should be helping all of this and is already being shown to reduce severe disease and hospitalisation. So I'm optimistic that having already achieved 17 million vaccine doses in this country, actually that can only help us get the kids back to school.
OK, let's bring in David at this point, and both vaccine questions to you, really. Whether you think that teachers should be in line and whether you're worried about the gap between the first and the second dose in terms of kids going back to school.
I'm not worried about the strategy of vaccinating as many people as possible with the first dose. That does seem to me sensible and based on the medical evidence. Of course, there is some risk that by having children go back before all of the vulnerable groups have had their second vaccination, there is a higher risk than if we shut things down for much longer and insisted that everybody had had their second vaccinations before young people went back to school. But the problem is that we have to manage the balance of risks in our society. And there are enormous risks from having 8 or 9 million children out of school for months and months on end to their future prospects, to the country's prospects, and to their mental health. So I think that what the government is doing by seeking to reopen on the 8th of March makes sense. But of course, there are some risks around it. And then on the issue of whether teachers should be vaccinated as a priority in the next stage, I agree very much with what Rachel said about the government being right to start with the older groups and those with underlying medical and health conditions. Once we get into the second phase of the rollout of the vaccinations, I do think that there is a case for looking at prioritising some of the groups, such as teachers, who have to go out into the workplace at this time and are more likely to be exposed to the virus, compared with people like me who are able to work perfectly happily from home. I would, in a sense, prefer that a teacher was vaccinated in preference to somebody who wasn't in a vulnerable group and was working from home. But medical advisors will need to input it into that decision with government, and then also need to tell government whether it's practical to differentiate between people in other occupations. It's probably quite easy for the NHS to identify older people and those with health conditions and call them in. Whether it's as easy to go through different high-risk occupations is an issue that we need practical advice on from those who are running the National Health Service.
OK, let's get a final thought now, a final couple of thoughts on wellbeing and support for young people.
So I know there has been a lot of anxiety within students about what our GCSE grades are going to be and our A-level grades. Luckily enough for me, I had support for my mental health from Action for Children, but I was wondering what schools are willing to do to support students as we come out of lockdown.
Does the panel feel it's a sensible approach for schools to include positive mental well-being for pupils as a part of the curriculum?
Perhaps with more outside classes?
Oh, aren't they lovely? Perhaps with more outside classes, but there's a serious point in all of this. You know, what could the legacy be from this pandemic, not just in terms of well-being, but, you know, how the kids can learn from it all? To you, Rachel.
No, I agree with your speakers. I think they had some great ideas. We know that being outside, sport, art, music, dance, the social connection which being in a school community brings is really healthy for young people, that well-being should be built into our school communities, not bolted on. And I don't know a head teacher in the country who isn't thinking really hard about their well-being strategy for young people. And I think that will, at its centre, be about listening to young people in the way that we have on this programme tonight, and actually listening to their worries so that we're responding to where they are in their return to school in this process of reconnection, which we're all, as teachers and support staff, really looking forward to. No teacher enjoys teaching over a laptop. And
Okay,
the
sorry
prospect
to
of getting
interrupt
back
you.
to school is
We're
really
just about to run out of time. Ellie, sorry, a final quick thought from you on that as well?
Absolutely. I mean, school is about so much more than education. It's about mental health, physical activity. For some kids, it's about food and avoiding some of the aspects of poverty. And I think this pandemic should have really brought that home to all of us as adults. And it absolutely has to be a priority coming out of the pandemic.
Okay, thank you so much. Sorry to rush you all there, but I'm afraid that is all we have time for on this edition of COVID and the Classroom. So all that's left for me to do is thank our panel this evening, David Laws, Rachel Warwick and Ellie Cannon. Thank you very much. And also thank you to all of our contributors who sent in their questions from home, and to you for watching us. Do remember, though, we have full coverage of Boris Johnson's announcement on the way ahead. That's right here on Sky News on Monday.